Just how crucial is it to focus on bleeding control in severe hemorrhage rather than definitive airway management? We're seeing the recommendations from all the different entities that have influence here coalesce to prioritize, control the bleeding before you focus on definitive airway management. Here's a paper that demonstrates the impact to the patient when these priorities get out of whack. This was an Israeli retrospective study that looked at over 1,500 patients over a 10-year period that experienced trauma, mostly penetrating trauma, that came through the ED and required surgical control of hemorrhage in an OR. And what they were doing was comparing mortality, ICU admission, and the need for blood transfusion between patients who were intubated in the ED, excluding patients who required immediate ED intubation, and patients who were intubated in the operating room. And what they found was that ED intubation, excluding those patients that required immediate intubation, was independently associated with increased mortality, increased ICU admission, and increased need for blood transfusion. This emphasizes the need, it's something that we say over and over and over again now, to resuscitate before you intubate. Remember that you are not the only one resuscitating your patient. Your patient is participating in their own resuscitation through their compensatory mechanisms. And when you paralyze them and give them sedatives, you are either taking away their compensatory mechanisms or severely blunting them. Resuscitate before you intubate.